wonderful students. Welcome back to North Brainy Academy. So, firstly, in this academy, we always acknowledge God. We give God Almighty the praise. So, today we have some questions to assess our students, those that partook in the simplified private lecture room, the lectures on cataract. And I believe every student that partook in that simplified lecture should not fail any of these questions. Now, like I told you, the reason why we are doing this is because these are places where questions can be extracted from in council. These are past questions, so don't joke with it. If it is possible, you write it down because they are very important questions you should not joke with. Are we together? So we're going to be fast. Now I want you to be writing. This is a live class, so I want you to be writing your answers in the comment section so that I'll be seeing your answers so that the class will be what? Interactive. So number one question. Cataract is defined as A, inflammation of the cornea, B, opacification of the crystalline lens, C, increased intraocular pressure, and D, degeneration of the retina. I'm impressed with the student that joined now. Okay, let's check the correct answer. So some students are choosing B, but let us check the right answer. So if you choose degeneration of the retina, you are wrong. If you choose increased intraocular pressure, you are wrong. If you choose opacification of the crystalline lens, you are correct. So the right answer is what? B. Don't forget this in case of your exams. Are we together? So cataract is best defined as the opacification of the what? Crystalline lens. Don't forget this in case of your exam. Now, number two, the most common cause of cataract worldwide is A, trauma, B, congenital defect, C, aging, and D, infection. So, what is the most common cause of cataract worldwide? We have A, trauma, we have B, congenital defect, C, aging, and D, infection. Now, if you choose D, like some students, if you choose D and you are, I believe those in the previous class, the simplified class in Telegram, we know the correct answer. Now, if you choose D, you are wrong. For all the students that chose D, you are wrong. If you choose A, you are wrong. The most common cause, all these are causes of cataract. But now, in your counsel, make sure you read properly, read the questions clearly, and understand the pinpoint answer they are demanding from you. Because one question can cause a student to fail, and one question can cause a student to do what? Pass. And if you choose A, you are wrong. If you choose B, you are wrong. If you choose D, you are wrong. To all the students that chose C, aging, don't forget this, you are correct. So the most common cause of cataract worldwide is what? Aging. So trauma can cause cataract, congenital defect can cause cataract, infection can cause cataract, but the most common cause of cataract worldwide is what? Aging. All right. Now, number three, which seemed I'm impressed with all the students that are attempting these questions in this live session. I'm impressed. Keep it up. I'm impressed. It shows that you are eager to learn. So, which symptom is most characteristics of cataract? A, severe eye pain. B, gradual painless loss of vision. C, sudden blindness. And D, purulent eye discharge. Which symptom is the most characteristic feature of cataract? We have A, severe eye pain. B, gradual painless loss of vision. C, sudden blindness. And D, prurient eye discharge. I'm impressed with all the students. Now, if you choose D, you are wrong. If you choose C, you are wrong. If you choose A, you are wrong. The correct answer is what? B. B is the correct answer. Gradual. Cataract is gradual. Painless loss of vision. So B is correct. Number 4 will be fast. Which type of cataract occurs as a result of aging? This question comes out in exam. Now, don't joke with glaucoma, cataract, myopia, hypermetropia, presbyopia, strabismus, stye, calision. All these comes out in exam, and we will have classes on all these so that we will complete everything about the eye, the med-surg aspect of the eye and the anatomical aspect of the eye. So make sure you know this before you enter the exam hall. So back to our question, which type of cataract occurs as a result of aging? Congenital, secondary, senile cataract, and traumatic cataract. So I want you to think rationally and give me your answer. And if you choose traumatic cataract, you are wrong. If you choose congenital cataract, you are wrong. If you choose secondary cataract or senile cataract, between secondary and senile, which occurs as a result of aging, and if you choose senile cataract, you are correct. Secondary cataract, wrong. So the type of cataract that occurs as a result of aging is what? Senile cataract. Don't forget this question. This is a past question. Don't forget it. Senile cataract, which I explained in the private lecture room. Senile cataract occurs as a result of what? Aging. I love those that are attempting. Keep on attempting. All right. Now, number 5. A patient with cataract commonly reports A. Floaters and flashes of light. B. Halos around light, especially at night. C. Complete loss of peripheral vision. And D. Severe photophobia with pain. A patient with cataract commonly reports A. Floaters and flashes of light. B. Halos around light, especially at night. C. Complete loss of peripheral vision. And D. Severe photophobia with pain. So, what is your answer? Now, if you choose D, severe photophobia with pain, you are wrong. If you choose C, complete loss of peripheral vision, you are wrong. Remember, the question says commonly reports. If you choose B, halos around light, especially at night, you are correct. So the right answer is what? B. Don't forget this. So a patient with cataract commonly reports halos around light, especially at night. Are we together? If we are together, I want to see your comments that you can hear me and we are together. Are we together? Now number 6. Okay, I'm impressed. Now number 6. Which risk factor increases the likelihood of developing cataract? Which risk factor increases the likelihood of a developing cataract? A. Prolonged ultraviolet light exposure, low fat diet, regular exercise. D. Hypotension. Which risk factor increases the likelihood of a developing cataract? A. Prolonged ultraviolet light exposure. B. Low fat diet. C. Regular exercise. D. Hypotension. Now, if you choose D, you are wrong. If you choose C, you are wrong. If you choose B, you are wrong. If you choose A, you are correct. when a person is always exposing the cornea, the lens, to light, being ultraviolet light, it can cause cloudiness, which is what cataract. So the right answer is what? A, ultraviolet light exposure. Number 7, which disease is strongly associated with cataract formation? Which disease is strongly associated with cataract formation? A, asthma, B, peptic ulcer disease, C, diabetes mellitus, and D, rheumatoid arthritis. Which disease? This question is very important. Which disease is strongly associated with cataract formation? We have A, asthma, B, peptic ulcer disease, C, diabetes mellitus, and D, rheumatoid arthritis. And if you choose A, you are wrong. If you choose B, you are wrong. If you choose C, you are correct. You're not wrong. If you choose D, you are wrong. So diabetes mellitus causes a lot of things to the eye. So in your exams, whenever you see diabetes mellitus, that will be the most common answer. Are we together? Glaucoma, diabetes mellitus, cataract, diabetes mellitus. Diabetes does a lot of things in your exam. So in your exam, when you see diabetes DM, you should know that that might be the correct answer because of the release of sorbitol. Are we together? Now, number 8, long-term use of which medication may predispose a patient to cataract development? Long-term use of which medication may predispose a patient to cataract development? A, antibiotics, B, corticosteroids, C, antihistamine, and D, antacid. Long-term use of which medication may predispose a patient to cataract development? Now, if you choose D, you are wrong. If you choose C, you are wrong. If you choose A, you are wrong. If you choose B, corticosteroid, you are correct. Now, don't forget this. Now, this quiz is just to test your brain and your ability to answer questions fast, and the need for you to either revisit or study harder on a particular council question. Then I will throw a little light on some things. Steroids predisposes a patient to cataract formation. Write it down. Steroids predisposes a patient to cataract formation. Diabetes mellitus is a form of secondary cataract. Diabetes mellitus predisposes a patient to cataract formation. The most commonly cause of cataract from this class is what? Aging. Cataract as a result of aging is called senile cataract. Cataract can be defined as the opacification of the word crystalline lens. All these things are knowledge you are gaining from this quiz. Don't forget it. Are we together? Yes, we are together. Now, number 9. Number 9. The diagnostic test